Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute. In this session, we are going to cover alcohols and disulfiram. So, without any further delay, we will move into the session. So, what is an alcohol? So, alcohol is a primarily form of an ethyl alcohol. So, this is a drug. Ethyl alcohol you can call as an ethanol as well. Ethyl alcohol, what is the next name for ethyl alcohol? The most common you can hear the ethanol. You had heard the name ethanol. Ethanol is nothing but ethyl alcohol. It is a primary form of ethanol. What is an alcohol? It is a primary form of ethanol and has occupied the most important role in the history of humankind from last 1800 years. This is a drug which has been occupied very important place from the last 800 years, 8,000 years, right. So, this is a form of an ethyl alcohol and these alcohols are hydroxy derivatives of aliphatic compounds. What are the alcohols? Alcohols are the hydroxy derivatives of hydrocarbons, aliphatic hydrocarbons. These are the derivatives. Which derivatives these are? These are the derivatives of the aliphatic hydrocarbons. And when alcohols are unpurified, if you are not purified the alcohols, if the purification is not completed, the alcohol you can call as an ethyl alcohol or ethanol, right. So, unpurified form of an alcohol you can call as an ethyl alcohol or ethanol, and this alcohol has been manufactured by the fermentations of sugars. So, how this alcohol has been manufacturing? This alcohol has been manufacturing by the fermentation of any sugar. By fermentation of the sugars, by fermentation of these sugar products, you can produce the alcohol, you can manufacture the alcohol. And alcohol is the most commonly abused drug, yes or no? It is the most common abused drug which can be used overall. So, this is a drug which has been used in entire world, and especially if I am talking about in United States, mostly approximately 75% of these drugs has been taken, most of the adults has been consumed the alcohol. So, this is a very widely used abused drug, especially in USA 75% of adults can consume the alcohol. So, in today alcohol is widely consumed, and due to the consumption of this alcohol, one of the reasons the alcohol can produces the sedative and hypnotic action. The alcohol can produces the moderate amount, it can relieve the anxiety. After taking of the alcohol, what the action you can see with this alcohol? Alcohol it reduces the anxiety, it can reduces the stress, what you are feeling in your nowadays, it can reduces the stress, it can reduces the anxiety, it can produces somewhat sedative and hypnotics, it can relieve the pain, right. So, this is the major effects of these alcohols, and this is the most acceptance one nowadays we are taking entire world, most of the people. And what is the classification of alcohols? Alcohols has been classified mainly into three categories. What are they? Primary alcohols, secondary alcohols and tertiary alcohols. So, alcohols has been classified into three types. What are they? Primary alcohols, secondary alcohol and tertiary alcohols. If I am talking about the primary alcohol, it further divided into methanol and ethanol. So, methanol and ethanol, what are these drugs? Methanol and ethanol are the primary alcohols. So, what is these drugs? These are the primary alcohols. What about the secondary alcohols? Isopropanol. So, isopropanol is a secondary alcohol, right. What about the tertiary alcohol? Tertiary butanol. Tertiary butanol is a tertiary alcohol. So, if you are talking about this alcohol, it has been categorized into three forms. What are they? Primary alcohol, secondary alcohol and tertiary alcohol. In primary alcohol, it has been further divided into two types, one is ethanol and second one is methanol, right, methanol and ethanol. And what about these secondary alcohols? This secondary alcohol, what is the example of these secondary alcohols? Isopropanol. What is the drug? Isopropanol. And what about these tertiary alcohols? Tertiary butanol. So, tertiary butanol falls under tertiary alcohols, isopropanol falls under secondary alcohol, ethanol and methanol falls under primary alcohol. These are the classification of alcohols. And what is the negative effects of alcohols? After consuming of alcohol, what are the negative effects you can observe with this alcohol? First, the major side effect or major negative effect of this alcohol, it will shrink the brain. So, after consuming of this alcohol, it having capacity to shrink the brain. You can observe this figure here, this is the normal brain, and after consuming of this alcohol, somewhat you can observe here the shrinkness of any brain. So, the shrinking of any brain is then a major drawback or major negative effect when you had consumed in a high level of any alcohol. Apart from that, it will reduces the sex drive. So, after taking of this alcohol, what is going to happen in high effects, it will reduces the sex drive. Shrinking of brain, just now I had said you, and it will causes the high blood pressure. After taking of this alcohol, it will causes the high blood pressure, it can causes the cirrhosis, it can causes the liver damage. After taking of this alcohol, what is going to happen? This alcohol, due to because of the aldehyde release, this aldehyde will damage the liver tissue, right. So, the alcohol when you have taken in a high levels or high concentration of any levels or a high consumption of alcohol, which can produces the liver damage. Apart from liver damage, it can produces the depression, it can produces the neuropathy, peripheral neuropathy is also one of the drawback or one of the negative side effect which you can observe with the alcohol. Apart from that, this alcohol is used, so is also cause the immunosuppressant. So, it can decreases the immunity system while taking this alcohol in a high level or high amount consumption, which will decreases the alcohol which will decreases the immunity. Apart from that, it will decreases the GIT secretions, it will increases the GIT secretions, it will produces the ulcers. So, whenever you are taking the alcohol, it will increases the gastric secretions like HCl. By increasing of HCl, what is going to happen? The ulcers will be produced. So, repeatedly taking of these alcohols, which can causes the peptic ulcer also. So, those persons who are having peptic ulcers are contraindicated to take the alcohols. So, these are the negative effects. One, it will decreases the sexual drive, it will shrink the brain, the blood pressure will be increased. Already the particular person who having the blood pressure and he or she is taking the more and more alcohol, and the blood pressure will be very much increases, and which will causes the serious collapse also. And it will causes the liver damage. Apart from liver damage, it will causes the neuropathy and will causes the depression, and this is the thing I had forgotten to explain, decreases the brain glucose metabolism. Whenever you had taken the drug, it will decreases the brain glucose metabolism, the alcohol will decreases the brain glucose metabolism. Apart from that, it is an immunosuppressant drug and it will increases the gastric acid secretion. So, it is contraindicated in peptic ulcer. And what are the pharmacological actions of the alcohol? So, if I am talking about the local actions, the alcohol having the local actions and systemic action as well. So, first I am discussing about the local action. When you had taken the alcohol, what is the local action? You can see it is used as a rubificant action. The rubificant is one of the major thing you can use local purpose, and it is used as a counter irritant and antiseptic, right. Even you can use alcohol as an antiseptic, you can use it as a rubificant drug, you can use it as a counter irritant. So, these are all the local actions with the alcohol. And what are the systemic actions? First I am discussing about the CNS. So, CNS. In CNS you can see the neuronal depression. So, whenever you had taken the drug alcohol, it will causes the CNS depression, it will depresses the brain, and it enhances the both GABA and glycine mediated inhibition. So, after taking of this drug, so because alcohol having a slightly sedative action, right, it will calm down the patient, it will decreases the excitation. So, this is the drug which will enhances the GABA and glycine action, right. And whenever you have taken the alcohol, it will inhibit the calcium entry. So, it will inhibit the calcium entry throughout this channel, and if it inhibits the calcium entry, there will be no opening of calcium channel. This is also one of the action you can see in here. And next one, inhibition of inotropic glutamate receptor function. So, you know that the glutamate is an excitatory neurotransmitter. So, the alcohol having capability to inhibit the glutamate release, and it will inhibit the binding this glutamate to its receptor. These are the CNS effects. What are the CNS effects effects of alcohol. First, it will causes the CNS depression, neuronal depression is one of the major action with the alcohol. Apart from that, it will enhances the GABA action and glycine action, and it will inhibit the neurotransmitter action like glutamate. It will inhibit the excitatory neurotransmitter action and it will promote the inhibitory neurotransmitter action. Okay. Apart from that, it will inhibit the calcium channels. Okay. These are the action on CNS. And we are moving to the next one, action on CVS. So, what is the action on cardiovascular system when you had taken the alcohol? It is in a dose dependent. It completely, you cannot say the alcohol can causes the tachycardia, it cannot say the alcohol can produces the bradycardia. It completely depend upon the dose, what the dose you are taking or what the dose you are consuming into the body. So, at the low dose or a moderate dose, what is going to happen, and at high dose what is going to happen. So, if any particular person had taken the mild dose of an alcohol, so you can see the vasodilation. So, vasodilation can increases the vasodilation. What is going to happen here? It can decreases the blood pressure, it can decreases the heart rate, and finally, you can see the bradycardia action. So, at a moderate, at a slow dose, at a small dose, it can causes the vasodilation. What about the moderate dose? In moderate dose, the alcohol having capability to increase the sympathetic flow. If the sympathetic flow has been increases, what is going to happen? Heart rate will be somewhat increases, right, and the blood pressure is also somewhat increases. So, in moderate dose also the alcohol having capacity to increase the heart rate and increases the blood pressure. And if you are taking the chronic alcoholism, if you are taking the more alcohol and who is addicted for that alcohol, in this chronic alcohol, you can see the hypertension, completely the heart pressure will get increased, the blood pressure will get increased, the heart rate has been increased. So, this will be seen in which condition? Chronic alcoholism. So, in CVS the action of alcohol is related to the dose, at which dose you are going to take. At the low dose, it will shows us the vasodilation action, it causes the bradycardia, and at moderate dose and high dose somewhat it will increases the hypertension. And what about the respiration? And respiration, it having the direct effect, and whenever you had taken this alcohol, it having the direct action on respiration, it will causes the respiratory depression action. So, alcohol having the respiratory depression action. And next, what is the action on blood? So, if I am talking about this blood, the alcohol having one therapeutic use in the blood, like it will increases the HDL levels. What are the HDL levels? High density lipoprotein levels. These are the good cholesterol, you can call it as a good cholesterol. So, once you are taking this alcohol, it can increases the HDL levels, high density lipoprotein levels, and it will decreases the LDL levels. LDL levels LDL levels, what is mean by LDL levels? Low density lipoproteins. So, by taking on a moderate dose, here note the point in the moderate dose, not in a high dose or not in a low dose. When you are taking in a moderate dose or a therapeutic dose, the alcohol can increases the HDL levels and it can decreases the LDL levels. And what is the pharmacological action of alcohol on GIT? So, in the previous slide I had explained you the alcohol, when you had taken the alcohol on GIT, it can increases the secretion. What secretion is going to increases? The acid secretion is going to increase. So, if any person having the taking the more consumption of alcohol, sometimes which can causes the peptic ulcer also. So, this is the reason why the alcohol is contraindicated in peptic ulcers. Already peptic ulcer is in a state which is happened due to the increasing of an acid secretion, and if you are taking this alcohol, the alcohol is also in turn increases the acid secretion and which will worsen the peptic ulcer condition. So, this is the reason why you should not take both, why you should not take alcohol in this particular disease, right. And what is the action on liver? If you are taking the alcohol, alcohol is an enzyme inducers, right. It is an enzyme inducer like a barbiturate. It is also an enzyme inducer. So, by enzyme inducer, it is an enzyme inducer, and acetaldehyde is an intermediate product of an alcohol and which can damage the hepatocytes. So, this is the thing which you can see with this alcohol drug. So, alcohol, you can know that the alcohol can damage the liver cells, hepatocells. How it is going to damage the hepatocells? It is going to damage the hepatocells by releasing of the intermediate product like aldehyde, which can having capability to damage the hepatocytes. And we are moving to the next one, pharmacological action, skeletal muscle. Skeletal muscle, if you are taking the chronic alcoholism, what is going to happen? Skeletal muscle weakness. So, in a patients who having the chronic alcoholism, who are taking in a chronic use, the alcohol can causes the skeletal muscle weakness. So, skeletal muscle, you can feel the weakness of any skeletal muscle. This is one of the pharmacological action of alcohol. And next one is sex. So, sex, here you can see the chronic alcoholism can produces the impotence. So, it can decrease alcohol can decreases the sex drive, it can causes the impotence, it can causes the gynecomastia, infertility, all these are the things when you had taken the alcohol. This is the action on the sex, both in male and female. And what is the endocrine effects? What is the endocrine effects of an alcohol? It can increases the adrenaline release. So, it can increases the adrenaline release. This is the reason I had said you that when you had taken the alcohol in a moderate dose, it can increases the sympathetic outflow. It can increases the adrenaline release. By this adrenaline release only you can see the increase in blood pressure and you can see the tachycardia of a particular patient. And uterus, when you had taken this drug like alcohol, it can causes the uterine contractions will be suppressed. So, the suppression of uterine contraction will be observed with the drug alcohol. So, these are all the pharmacological actions which you can see with the alcohol. Okay. And before going to alcohol, we will just see what are the drugs you can use here. So, it having what is the pharmacological actions. So, we will just rewind here. You having the local action, you having the systemic action. In local action, it can used as an antiseptic, rubificant, and it can use it as a counteragent. And what about the systemic action on CVS? It will causes the on CNS, it causes the CNS depression. Apart from CNS depression, it can promote the GABA action and it can inhibit the excitatory action like glutamate. Apart from these two actions, it can inhibit the calcium channel. Okay, this is one of the action on CNS. On CVS, it will causes the membrane stabilization activity. It mean it can causes dose dependent action. If you are taken the alcohol in a low dose, it can causes the vasodilation, or if you are taken in a moderate dose and high dose, it can causes the hypertension. And what is the action on respiration? On respiration, it can causes the respiratory depression. What is the action on blood? It can increases the HDL and it can decreases the LDL levels. And what is the action on GIT? On GIT, you can see the gastric acid secretion will be increased. The acid secretion will be increased with the drug, right. And what is the action on liver? Due to because of intermediate product of alcohol, after when the alcohol enter into the liver, when the alcohol is going to metabolize it, you can see the intermediate product like aldehyde. The aldehyde is an aldehyde is intermediate product, it is a metabolite which will damage the hepatocytes. This is the reason why the alcohol more and more consumption can causes the liver damage. Apart from that, if you are taking the alcohol, it can causes the decrease in skeletal muscle tone. It will decreases the skeletal muscle tone, it causes the skeletal muscle tone weakness. And what is the action on sex? It can decreases the sexual drive, it can causes the impotence, it can causes the gynecomastia, it can causes the infertility. So, these are all the drugs, these are all the actions when you can see after taking of this alcohol. And what is the action on endocrine system? It can release the adrenaline. By releasing of this adrenaline, it will go and bind to its receptors, and after binding to its receptor, what is the action on the system or CVS? So, it will increases the heart rate or it will increases the blood pressure. And what is the action on uterus? When you had taken the alcohol, it will suppresses the uterine contractions. It means it having relaxation action on uterus. So, what is the dose and how you can prevent the alcohol abuse? So, if you see, to prevent the alcohol abuse, what you have to take here? Disulfiram. Disulfiram is a drug to prevent the alcohol abuse. You can give the disulfiram drug. And next one, AKtU. AKtU is also another drug to use it to treat the alcohol abuse. And next one is naltrexone. So, naltrexone is also a drug which is used to treat the alcohol abuse. So, particular person who having alcohol abuse, you can give these three drugs like disulfiram, AKtU and naltrexone. Okay, these are the drugs. In which dose you can give here? Disulfiram you can give by oral, and this AKtU also you can given by oral, and this naltrexone is a drug can given both route oral and parenteral. So, we will see about the dose, in which dose you can give these drugs. Especially these disulfiram you can give the 250 mg of tablets. You can given by the oral route only, you can give 250 mg of a tablet. And what about this acamprosate? You can give 133 mg of delayed release tablet. So, 133 mg you can give in the form here, right. And after of that naltrexone you can give 50 mg. So, here which dose you can give here? 50 mg of tablet. And what about here parenteral? You can give the 380 mg of intramuscular injection. So, in parenteral which route the drug is going to give here? Intramuscular route. Which route is going to prevent? This is the best therapy to treat the alcohol abuse. So, you have to take this injection only per month. No need to take the day by day. So, this is the injection if you are given in a parenteral route in a such a dose 380 mg and in intramuscular route you can take once in a month. At which dose? 380 mg. And the same drug you can take on the oral route also with 50 mg per tablet. So, these are the drugs which are used to treat in drug abuse. And what is the treatment of methanol poisoning? So, if any person having the methanol poisoning, what is the treatment you have? What is the treatment you have to follow? So, there is some treatment who having the methanol poisoning. First, you have to give the ethanol parenteral route. How much ethanol you have to give here? 5% or 10% of ethanol and 5% of dextrone in the water for IV infusion. You have to mix the ethanol and dextrone in the water. First, what you have to do here? If any person having the methanol poisoning, you have to give the ethanol in such a combination manner. So, you have to take 5% of ethanol or 10% of ethanol and you have to combine with dextrone 5% and this thing should be mixed in the water and you have to give on the intravenous infusion. So, this is the one of the treatment to treat the methanol poisoning. So, to treat the methanol poisoning, what is going to prepare here? Ethanol and second one is dextrone and it should be mixed in the water and will given in the intravenous route. So, how much ethanol you can take here? You can take 5% of ethanol or you can take the 10% of ethanol and you have to combine with the 5% dextrone and these two products will be mixed in the water and you can give in the intravenous infusion. And next one, fomepizole. Fomepizole is also a drug which is used in the treatment of methanol poisoning. How you can use in the treatment of methanol poisoning? You can give 1 gram per ml in intravenous injection by the parenteral route. Okay. So, both you can give by the parenteral route. So, if you are treating the methanol poisoning, what you are doing here? To treat here the both drugs, the ethanol also you can give the parenteral route and this fomepizole also you can give by the parenteral route. The doses will be the different, both will given by the intravenous injection only. Here the fomepizole has given 1 gram per ml. So, if any particular person having the methanol poisoning, you can suggest the drugs like ethanol in the combination or it can be mixed with dextrone and you can give in the intravenous infusion parenterally. And there is another drug, fomepizole is another drug which can be used in 1 gram per ml parenterally to treat the methanol poisoning. And we are moving to the next drug in your next topic in your syllabus. By this we can complete the 4th unit. We had discussed the entire syllabus in your AKtU portion, right. So, this is the last topic in your 4th unit which is a disulfiram. So, disulfiram, what is the drug here? This is a drug for those who having the alcohol abuse. In a particular person you can take the disulfiram. Disulfiram is an antagonist drug to the alcohol, right. So, what is a disulfiram? Disulfiram is an aldehyde dehydrogenase inhibitor. What is a disulfiram? Disulfiram is an inhibitor. Which inhibitor it is? Aldehyde dehydrogenase inhibitor. So, disulfiram is an aldehyde dehydrogenase inhibitor which is used especially in the chronic alcoholism patient. Those who having the chronic alcoholism who is not able to withdraw his alcohol habit in such a condition or in such a purpose, you can give this disulfiram drug and this is a drug which is going to inhibit the aldehyde dehydrogenase enzyme. And this aldehyde dehydrogenase enzyme like disulfiram, you should not given with the alcohol. If you had given the disulfiram and you had taken the alcohol consumption, you will see some aldehyde syndromes. What are the aldehyde syndrome you can observe here? You can see the headache, dizziness, visual disturbances, mental disturbances, burning sensation, tightness of the chest, all this will be happen, all these are the aldehyde syndrome. When you had given the disulfiram drug and the particular person had consumed the alcohol, then this aldehyde syndrome will be observed. Okay. So, the duration of this syndrome, so how like you have to give after giving of after duration of the syndrome 1 to 4 hours depend on how much of alcohol has been consumed for the particular person. So, the dose will be somewhat decreasing day by day. So, first the disulfiram on the first day will give 0.75 grams, on second day the dose will be little much less 0.5 gram, on the third day will give 0.25 grams subsequently. Thank you.